Now we examine the elbow. Initially, we will inspect, looking for any wasting, asymmetry, scars, swelling. Specifically, in the elbow, we'll look at the carrying angle, which is the angle between the humerus and the forearm. Next, we'll look at the range of motion, and we're going to combine both active and passive in this situation. I'm just going to ask Trish to put your arms out, and we're looking at level of extension. We can create a degree of hyperextension, feel the end feel. Now bring your elbows to the front. We're looking at flexion, and we can see quickly the difference in range of motion. Now we'll look at the amount of pronation supination, which is the movement at the proximal radial ulnar joint. Now bring your hands to this position, which is supination, into this position, pronation, and then maybe some mild loss of pronation, more on the right than the left. Next we'll palpate. Do you mind just stepping forward? Now we're going to look specifically at the common extensor origin, where the muscles that extend the wrist come from. This is the site of tenderness with tense elbow. Slightly posteriorly and slightly inferiorly, we will see this is a dip, which is the elbow joint, and below that is a rigid bone, which is the radial head. If we go in front and further distally, we actually feel a little gutter or groove, which is the site of tenderness for the supinator muscle. Next, we'll go anteriorly, palpate the biceps tendon, which runs in front from the biceps. Then medially, we'll find tenderness in medial epicondylitis, or with golfer's elbow at the medial epicondyle, and just behind it is the cubital groove through which the ulnar nerve runs. Next, we'll do some resisted testing. We'll resist extension at the elbow, flexion at the elbow, we will get the resisted supination, pulling your elbow out as if you're bringing the arm to this position. Then we reverse the hands and get the person to pull their arm into rotation into pronation, which brings the arm into that position. Next we will do resisted wrist extension for, again, tense elbow. Pull your wrist up towards the ceiling. The arm in this position has to be elbow fully extended and in a pronated position. Next we do middle finger extension. Then we turn around, bend the elbow, bring the wrist into slight flexion, and we do resisted wrist flexion for medial epicondylitis or golfer's elbow. And finally we will do a test for stability at the ulnar collateral ligament, stabilizing the forearm with your lower arm, stabilizing the upper arm or humerus with your higher arm. You basically create stress in about 30 degrees of flexion. You can use your body. What you do, you feel a nice little bounce, stress in the ligament at this point.